I'm Dr. Rebecca Bisner, a partner here at the Wheaton Animal Hospital. I've been here for about 9.5 years, and I've been a veterinarian for about 16 years now. I've pretty much always known I've wanted to be a vet since I was 7 years old. Always had a huge love of animals, always wanted to have as many in my house as possible, but my mom didn't let me. And then when I got my first pet of my own as a guinea pig at 7, I knew this is exactly what I wanted to do. I went to Eastern Illinois University for undergraduate. My major there was zoology pre-vet with a chemistry minor. After that, I did get accepted into vet school, and I went to St. George's University, which is on the island of Grenada in the Caribbean. Vet school is a 4-year program in which the first 3 years are spent in the classroom, and you do learn about all animals, dogs, cats, horses, goats, sheep, you name it, we learned it. And then your last year of vet school is actually the clinical year, and this is when you're spent actually seeing clients, working up cases, and like that. And so this is when you learn a lot about cardiology, dermatology, internal medicine, radiology, everything like that. Science is a big part of it. Mathematics, not quite so much, thank goodness, because I'm not very good at math. So as long as you know how to cross multiply, you can do this job perfectly fine. Here at the Wheaton Animal Hospital, there's a grand total of 6 doctors that are here, and it's a really nice group of doctors that we have. We've all been working together now for, gosh, I think like 6 or 7 years, which is fantastic. I really, truly enjoy what I do here. Is it easy? No, but is it thoroughly enjoying? Yes, absolutely. So a typical day, so we get here in the morning. We are a walk-in basis, and so we honestly have no idea what's going to walk in the door during the day. And so each day, one doctor is assigned to be doing surgery, and so then they'll be in here during surgery while the rest of us are going to be seeing rooms. We're just seeing clients throughout the day. So yeah, we have surgery. Sometimes we'll have to, perform ultrasounds, x-rays, and then for the surgeries, mainly it's just like spays and neuters, mass removals, just finishing up with dental health month right now, so we've been doing a lot of dentals. I mean, unfortunately, we're working with living creatures, so you will get peed on and pooped on. You'll see a whole lot of bodily fluids that you probably don't want to see. So that's a bummer part right there, but that's just kind of part of the job. All right, so this is Charlie. He is my 9-year-old Basset Hound, so I'm going to be doing just a physical exam. This is probably the most important, piece that we can do here as a veterinarian. This will kind of give me an idea in terms of health, any concerns or anything else like that. So typically I like to start at the head, and I just kind of take a look, make sure the eyes are looking nice and clear, no major discharge. Then we'll go ahead and take a look inside of the ears. So if I can lift up these big old ears and just kind of take a peek inside. I can also use my otoscope here as well to go ahead and take a look on the inside of the ear. Make sure everything's looking good there. That's looking wonderful. And then over here, looking good. I know that feels good, doesn't it? So then also continuing then with the head, we want to take a look at the teeth. So go ahead and we lift up the gums here and we take a look, and it looks like I need to schedule my own dog for a dental cleaning. And we take a look on this side, make sure I don't see any diseased teeth or anything. So that is all looking good. And then also here on the head, I'm going to take a few of the lymph nodes, make sure those are of normal size. And so overall, everything's looking great here on the head. Throughout my exam, I am going to take a few of all the lymph nodes. We have lymph nodes everywhere, but I just want to make sure all of them are looking nice and normal here then for us. Come on, Charlie, can you stand up? So then next I'm going to go ahead and take a good listen to his heart. The best way to hear it is here on the left side. And you always just want to make sure you hear, several beats. Make sure you're not hearing any murmurs, any abnormal beats or like that. And then I'll go ahead and I'll take a listen to the lungs. So I'm going to want them to make sure they take a couple of breaths then for me. All right, so then when I'm done with taking a listen to the heart and lungs is when I'm gonna take a feel here of the abdomen. And with this, I just wanna make sure that everything is feeling the way it's supposed to. I can go ahead and feel the edges of the liver that's here. If I move back a little bit more, I can also feel the intestinal loops kind of slipping through my fingers here. If the bladder is distended, sometimes I can even feel that. In kitties, especially if they're a good weight, I can actually go ahead and take a feel of their kidneys here as well. But also during this is when I could potentially feel any type of tumors, intestinal foreign bodies, things like that. So everything is feeling good here. Once we're done with that, I kind of head out here to the rear end here. So I'm going to check out the skin. The rear end area here is a perfect place that fleas love to hang out. So I always try to make sure that I take a really good look back here, pull up the fur just like this. This way I can see if there's any evidence of any fleas that are there. But also just kind of take a generalized feel. Do I feel any lumps or bumps that's causing me any concern? Because dogs, as they get older, we definitely can see some skin lumps and bumps that can pop up. Luckily, most of the time they are benign, but there are some others that we do get concerned about, so we are going to want to, take care of that. And then lastly here, I will go ahead. Charlie, if you can stand up here one more time, bud. Thanks. I'm going to go ahead and just take a look at the underside of the tail, make sure I don't see anything that's going on there that's causing me any concerns. But overall, everything is looking pretty good here, kiddo.